Hello, my name is Rahisha Gulich. I'm a nursing student with Nightingale College. Today I will be doing, this is my intradermal injection video. So I just got orders from the provider. The order is for a TB scan. The order is for a TB skin test, 0.1 ml ID. So I will first go ahead. I will uh, I will gather all my required materials, which I have here, and I will also verify the 6 rights: the right medication, the right dose, the right patient, the right time, the route, and the right documentation. Then I will calculate the dose of the medication that I'm administering, and for this video, it is the 0.1 ml ID. I will then go ahead and introduce myself to the patient. Hello, my name is Rahisha Gulich. I'm a nursing student with Nightingale College. Can I get your name and date of birth? I will verify 2 identifiers. Date of birth by identifying that and confirming it on the patient's wristband. Then we'll go ahead and provide privacy at the closing the door or the curtain. Okay, and then I'll ask the patient if they have any allergies. Hello, ma'am. So do you have any known allergies to food, medication, or seasonal? No? Okay, perfect. Thank you. Then we'll go ahead and discuss with the patient the intradermal medication injection for the TB skin, and I will discuss the actions, its uses, its common side effects, and I will also list them. And then I will discuss. I will let the patient know that they may experience like slight burning or a stinging sensation while I'm administering the injection. I will inform the patient the purpose, what we will be doing, and that's giving that injection that the doctor ordered. And then I will also instruct the patient to report any adverse side effects, and I will list them. And I will ask the patient, do you have any questions? No? Okay, perfect. Then I will perform hand hygiene. And put on clean gloves. I will verify with the EHR the correct medication and the 6 rights. I will verify the patient's the dose, the medication, the patient, the time, the route, the right time, and the right documentation. I will verify the 6 rights again and check it and make sure that it matches within the EHR. Okay, so I will then go ahead and I will get the correct needle, the correct gauge, and the length of the needle and the size of the syringe. So I am using the tuberculin safety syringe, 1 ml, 25 gauge, and 5/8 inches. So I'll go ahead and do that, and then I will draw Okay, so I have an alcohol wipe, And I will go ahead with the alcohol pad, wipe. And I'm using this, I only received these two, so I want to note that I only received these three. This is insulin, which I will not be using, and then I received this. It's the only other medicine, so I will be using this as my medication. So this is all that I received in my kit. Okay, and so I will go ahead and clean the top of the lid. Okay, discard this. Okay, so then I will go ahead and take my syringe and remove the cap, and then I will go ahead and I will then fill the syringe with the same amount of the medication, which is 0.1. So I will require that amount of air. So I will go ahead, 0. All right, and that is 0.1 of air. And then I will go ahead. Okay, so that is 0.1 ml of air. So then I will go ahead and I will hold the syringe with my dominant hand and hold the vial with my non-dominant hand, and then stick it in. And then I will go ahead and let out the air. And then I will go ahead and flip over the vial. And then I will go ahead and I will get 0.1 ml of the medication. Oh, sorry. 0.1 ml. Here we go. Okay. So then I will go ahead. I'll pour the medication into the syringe. Then I'll go ahead and flip it back over. Okay. And pull it out. And then I will go ahead and tap it to get rid of any bubbles, to remove the bubbles. Okay. Okay, so then I will go ahead and just verify again the right dose that's inside, which is 0.1. 0.1, and also verify that I have the correct medication and the correct dose. Okay. Okay, so for the area, I will go ahead and I will do 3 to 4 fingers in this area, and then the hand right here at the wrist, I'll go right here. So 3 to 4 fingers, and then the hand. So right about here is where I will administer the injection for the TB skin test. Okay. Okay, so I will go ahead and take my alcohol wipe and I will start in the center, a small circular, and then I will go ahead and go outer and outer. Before I do that, before I wipe it with the alcohol, I will go ahead and inspect the arm, inspect the site. And again, I will select 3 to 4 fingers width below the anticupal space, and then 1 hand above the wrist. And then I will go ahead and I will select the appropriate site and look for any lesions, any skin discoloration, rashes. Then I will go ahead and palpate for any tenderness. Palpate for any tenderness, and then I will go ahead and I will clean the site about 5 centimeters to 2 inches. Going outer, and then I will allow this to dry on its own. Okay, so now I am ready to administer the injection. It has dried on its own. My dominant hand, I will go ahead and I will hold the needle with my thumb and forefinger with my dominant hand, with my thumb and forefinger like this, and then I will make sure that the bevel part is facing up. With my non-dominant hand, I will stretch the skin. Okay, so my dominant hand, I want to make sure the bevel is facing up, and I'm holding it with my forefinger and my thumb, and then I'm stretching the skin with my non-dominant hand, and also with my forefinger or thumb. And then with the needle, I'm going to go ahead and I'm going to make sure that I have the bevel up, and I am doing it at a 5 to 15 degree angle. Make sure that the needle is advancing through the epidermis to depth about 3 millimeters skin surface. So I should be seeing a bulge from the needle to the tip. So I'm going to go ahead Okay, and then I'm going to go ahead and insert the medication in, and that's 5. Hopefully you can see that. I'm going to move my hand so you could be able to see a little bit better for video purpose, hopefully. And I'm going to go ahead and inject the medication in slowly. Okay, so while I'm injecting the medication, I should see a small little bleb, resembling like a mosquito bite that appears on it. So I inject, and then I'm going to go ahead and I'm going to withdraw the needle. Okay, And then I'm going to go ahead and place a gauze. This is my fake gauze. And then I'm going to go ahead and cap it. And I'm going to discard it into the sharp needle bin. I'm go ahead and discard it. Massage it. I will put band-aids on it if I need to. I would like to note, you do not cap it, but for a safety purpose, because I do have a little baby, a toddler running around, I'm capping it, but noting you do not recap the needle. Never recap a used needle. Okay, so just discard the needle and syringe in a sharp or puncture proof container. But since I'm at home and I have kids running around, I just want to be safe. And so then I can go ahead and remove my gloves. And then perform hand hygiene. And then I will go ahead and document this procedure. I will leave the patient in a comfortable position. And yes, I will go ahead and document the procedure, and that is it for this video.